There are days when you just crave for something sweet and milky. So today I'm making eclair while telling you about a bacteria that shares the same shape and possibly the same origin as eclairs, Listeria monocytogenes. Listeria monocytogenes is a longish-looking bacteria like eclair and has a deep purple color under gram stain. It's found in unpasteurized, contaminated milk product as well as in raw vegetable and deli meats. This bacteria can infect people, but the good news is, 1. Most of our milk products we find in supermarkets are pasteurized, and 2. The bacteria dies when we cook our food. And 3. If the bacteria do get inside our stomach for some reason because we drank unpasteurized milk or ate some unpasteurized camembert raw, most people won't get infected as long as they have a strong, robust immunity. Then, who are the people who will get infected with Listeria monocytogenes? Those are the people with weaker immunity, namely babies, because their immune system hasn't really developed yet, elderly people, because they have grown old and like many other parts of their body, their immune system also weakens, and immunocompromised people, which means people with conditions that lower their immunity, such as lymphoma, or those taking immunosuppressant drugs, such as steroids. So these conditions and drugs compromise their immunity, so they're called immunocompromised people. Lastly, Listeria monocytogenes can also infect pregnant women because pregnant women lower their immunity so that the mother's immune system won't go attacking the fetus. So it's actually a physiological thing, a normal thing, that pregnant women might have slightly lower immunity than normal people. When Listeria monocytogenes manage to infect a person, it can cause some very serious trouble. First of all, it can cause meningitis, which is inflammation of the tissues and spaces surrounding the brain. Inflammation means swelling, and swelling inside the skull means squishing the brain. So ultimately, meningitis will cause brain damage, although the problem started in the layers outside the brain. When Listeria monocytogenes infect a pregnant woman, it can cause meningitis too, but sometimes the woman doesn't present with meningitis, but we already know that she's infected with Listeria monocytogenes. That is because in pregnant women, infection with this bacteria more commonly presents with miscarriage, in other words, losing the baby in the first and second trimester, or preterm labor. And that is because the bacteria stresses both the mother and the fetus so much that it becomes very difficult for the pregnant woman to continue pregnancy. And voila! Here are my completed eclairs, looking a little bit like Listeria monocytogenes, which are gram-positive rods. They look pretty darkly purple under microscope. Thank you for watching my video.